Hey everyone, so today's video we are going over front of the neck, maybe a little bit of chest tension today, okay? So if you're one of those people who you notice, I don't know, maybe every time after I exercise, run, or sit for long periods of time, I have this tightness, maybe even sharp shooting pain through here and into the chest. We are going to go over 2 different exercises that you can do today to try to decrease some of that tension. My name is Dr. Dawn. I work at Performance Place Sports Care. I'm just one part of the locally world famous chiropractors here in Orange County. And if you like this video, if it works well for you, we do have a channel that you can go to where we've made tons of content like this for all different areas of the body. So if you have somebody you want to share those videos with, or if you have other areas you want to work on, or even just more about what to do with this, go to our channel, like and subscribe. In the search bar, you can type it in on what you're looking for, and I promise you it will pop up because we have a lot of stuff on there, okay? At some point during the exercise, what we're going to go through, there's going to be something that pops up on the screen as well. It says free gift. The reason we've created a free gift for you guys is because people usually ask, what do we do next? This worked really well. I want to know what the next step is. Take advantage of that free gift when it pops up, okay? So let's get into it, okay? So we are talking about, again, the front of the neck and some chest pain, okay? Certain things that we want to take into consideration is if this is the left side of the body, shortness of breath, maybe some mid-back pain, and some issues when you're exercising, like all of that stuff, shortness of breath and back pain come on like that, maybe radiating pain down the arm. This video is not for you. Maybe go see a doctor for that, okay? But this is, I have some tension and some tightness through here. Maybe stretching a little soft tissue helps. It feels like this pec on this side is just a little bit tighter as well. That's what we're going to go through today, okay? So a little education piece is there are nerves that come out of the neck here, and they supply all these muscles into the chest, into the back here, down the arm, and sometimes those get really pissed off if they get loaded, if they get stretched, compressed, however that happens. They get a little pissed off, and this is what shows up. So something really, really simple, and it may seem like it's too simple. The first thing is to deload it. So while we're watching this video, if you currently have that pain going on, I want you to, all you do is take your arm and rest it on the top of your head like this. I'm going to share a little story of a patient while we buy some time in this position. I've actually had a couple of patients who come in with this, okay? And it simply is just detensioning those nerves. Think about like a rubber band. When we're stretching a rubber band, they get pissed off because they're stretched. But we're kind of slackening that rubber band right now when we bring our arm overhead. If this feels like it helps, your fingers don't really fall asleep, and it kind of takes some of that tension off, I want you to buy time in this position for about a minute. Maybe breathe. If you want to do it laying down, that's fine. But let's just buy some time in this position, and then I want you to retest and see if that helped a little bit. It really, truly can be that simple, okay? But that also is just a temporary thing. So dose it out for a short amount of time. Maybe use this all throughout the day for about a minute with some breathing and seeing if buying time with detensioning those nerves will help. How do we keep that from coming back and being a chronic issue though, so you don't have to do this the rest of your life, is we want to load into that position as well. Create support around the area. So we're going to do a low bear exercise, okay? So elbows wider than the shoulders, make a diamond with your hands, okay? I want you to bring yourself so your feet are up against the wall here, just like this, toes curled under, because that's going to be a part of this issue, part of this exercise. Okay, so from this position, what we're going to do is I'm going to have you take your eyes, look in between the space in between your knees. What does that mean? It looks like this. Okay, so my knees stay on the ground and I come up into this position here, all right? From this position, I want you to make sure you're not leading with your butt up, okay? You're allowing the hips to stay heavy and let the core curl you into this position here, all right? We're going to now bring our knees up off the ground about an inch, and then through your hands, forearms, and shoulders, you're going to push your butt towards the wall and push the floor away from you, and you're going to hold here. Pretend I have my hand in between your shoulder blades and the base of your neck. Push me up. Push me up, push me up, push me up, push me up. Hold as long as you can and come back down, okay? You know you're doing this right if you feel the shoulder stabilizers working as well as the belly. Probably a lot of belly and a lot more, and then a little less, but more of the shoulder here, okay? So again, let's do that position. Here, look through the space. Bring the knees up, push the butt towards the wall and the floor away from you. And you're going to hold and breathe. Do not let me push you down between your base of your neck and shoulder blades. Come up, 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 push, 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 hold, 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 breathe, and slowly come down, okay? Pause the video and try that to fatigue, and then again, retest and see how that feels. At no point should you feel your symptoms while doing that exercise. If you do, play with elbow position. Play with pressure through the floor. If those don't work, there are other exercises that will work for you. Search on our YouTube channel or reach out to us. We can help you in person or virtually at this time. Whew, I'm a little out of breath. That's a good one. So if you'd like to be able to figure out which one else can I do, or what more can I do, because that worked really well. Take advantage of it, reach out, and take advantage of that free gift that popped up. It's really going to help you.